So we've heard a little bit about KRAS being a druggable target in one of our opening sessions on the Wednesday, and I think we've got a long way to go with KRAS. At the moment we've got 2 licensed drugs globally, one available in the UK which is Sotorasib, the other agent is Adagrasib, both licensed, and they have modest activity in the relapse setting. They are drugs we have access to and we should use advisedly and correctly, but I think it is fair to say that activity is modest. We have response rates of around 30 to 40% and progression-free survival rates of around 5 to 7 months, which is okay, but I think we'd all agree it's not earth-shattering, and we certainly need to up that curve to get more effective treatments. The other aspect with the available drugs is some of the toxicities, particularly gastrointestinal and hepatic. So how can we improve the available drugs? Well, one approach is to combine them with immunotherapy in the first-line setting. Now that needs to be done with caution because there has been some toxicity, particularly with full-dose pembrolizumab and full-dose Sotorasib. But there are other combinations of KRAS inhibitors, this is G12C inhibitors, and immunotherapy. And the other approach is to try to block those resistance mechanisms which occur so easily with KRAS. So trying to combine a KRAS inhibitor with other inhibitors like SHP2, SHP2, or SOS inhibitors, and maybe by blocking those we might get greater efficacy. So that's the G12C side of it. That's the most common of the KRAS mutations. But there are many other KRAS mutations, and I think that's probably the data that caught my eye the most at ESMO last year. We're beginning to see pan-KRAS inhibitors. Now, data is very early, often phase 1. We're just seeing mainly safety, a little bit of efficacy data. But I think there is that data, and I think there is that data that there are agents coming through which are going to be able to be more of a pan-KRAS inhibitor. So if your patient has a KRAS mutation, but it's not a KRAS G12C mutation, I think there will be agents coming through to that. In early phase at the moment, but hopefully coming through later.